This is Adult Comprehensive Physical Examination Video Script for Advanced Health Assessment, MSN level. Introduction. Hello everyone, my name is June, and today I'll be demonstrating a comprehensive adult physical examination. During this demonstration, I will explain how to properly prepare for the examination, discuss the appropriate sequence of the assessment, and describe the patient positioning while conducting each component of the exam. I will conclude by discussing my analysis and documentation of the findings in the patient's clinical records. By preparation before exams, before beginning any physical examination, both the clinician and the patient must prepare properly to ensure safety, ensure that the client is comfortable, and accuracy, so that there should be accuracy of findings. So the provider must be prepared. The clinician should review the patient's health history and chief complaint. Should perform hand hygiene and ensure standard precautions when necessary are adhered to. It should be able to maintain professional appearance and demeanor. Prepare all necessary equipments beforehand and ensure a private and well-lit environment. I'm going to show you this, that I have all my equipments seated right down there. I hope you can see it. I lined them up. Okay. I'm going to be using our mannequin there for this examination, and hopefully we would be able to do what we can with him. Okay, the patient preparation. We have to introduce yourself and verify the patient's identity by the patient's name, and ask if the patient knows where they are and what they're here for. Ask if they know what their names are and what room they're in, and explain the purpose of your examination to the client. Then you obtain their verbal consent for whatever it is that you're about to do with them. When that goes on, you ensure privacy by closing the doors. I'm going to close the door right now. There you go. And by closing the doors and asking the patient to change into a gown. Now, our patient here is very, okay, let's say I gowned him. Okay, all right. And ask the patient to change into a gown. Position the client comfortably. I try to. We're going to start with him sitting up. So I put him in that position. And then ensure that the patient has emptied their bladder if it's needed, and start asking if the patient has any pain or concerns before starting. Now, this would be an example of what I would say. Before beginning my examination, I introduce myself. Hello, let's say his name is John. Hi, John. Um, can you please tell me what your name is? And then he will tell me what his name is, ask what his room number is, and then if he's able to do that, then we move on. There should be 2 identifiers. So you explain the procedure and obtain consent from him. So we're going today to be assessing you and making sure that everything is okay with you on your well visit, okay? And are you comfortable? Or would you permit us to do this? Hypothetically, he says yes, okay? All right. And I ensure the environment, I have to make sure that the environment is private. I close the door and he looks comfortable. Ask, are you comfortable? Is it a yes or a no? And then make sure all the equipment I need is around and ready to be used. So like I showed earlier on, I was able to get the stethoscope. There's a blood pressure cuff here. Blood pressure cuff here. I have a thermometer here. I have a pulse oximeter here. I have a pen light. I have a reflex hammer. I don't have a tuning fork, and I tried looking for it. That's one of the reasons why I'm coming this late with this video. We have an otoscope, a tongue depressor, and we do have an ophthalmoscope. We have a measuring tape. Oops, it's not part of this, but okay. A measuring tape, and then we have gloves, we have alcohol wipes, and hand sanitizer. Okay. After doing that, there's an exam table. We're going to use a bed for the examination, and we have dripping sheets. I didn't get those. Anyway, I've assembled all the necessary equipment, including a stethoscope, blood pressure cuff, hammer, reflex hammer, tuning fork should be here, but I couldn't find one. Orthoscope, ophthalmoscope, the pen light to ensure that the exam proceeds efficiently without interruptions. So the sequence of the comprehensive physical examination. We're going to start from head to toe, use a head to toe approach, and it's typically used to ensure no system is overlooked. The general survey and vital signs, patient's positioning. So we have him sitting up. I'm going to bring you closer, okay? Okay. So we have him sitting up.